joined by a number of my colleagues. I thank them for being here. First, of course, is our new health commissioner, who, as I've said, has had a nice, easy transition into the position, Dr. Gregson Piggott. Appreciate all of his work and his team and the Department of Health, great work that they are doing during this crisis. We also have, of course, the Deputy Commissioner of the Department of Health Services as well, Dr. Iftikhar. I would thank her as well. Jen Colton from the Suffolk County Department of Health. And again, the team in the Health Department appreciate all the work that they've been doing with this health crisis. We also have the Director of EMS and Public Health Emergency Preparedness, Nat Bialik, here. Of course, our Chief of Police, Stuart Cameron. I want to thank the Police Department, and our Commissioner of the Department of Fire and Rescue and Emergency Services, John Jordan, as well. Our new Commissioner of the Suffolk County Department of Public Works. We have some new commissioners here, so this is interesting for them. Coming on board at this time. Joe Brown is coming to us from New York State with extensive experience, so we are very happy to have him on board now. And our Director of Operations, Tom Vaughan, here, and of course our IT Commissioner, Scott Maslon. So again, thank you everyone for being here today. As I'm sure everyone is aware, we've had our first confirmed case of the coronavirus in Suffolk County. The patient, a male in his early 40s, remains in hospital isolation. Suffolk County Communicable Disease professionals have begun a thorough investigation into the patient's contacts, as it believes the person in this case contacted the virus through community transmission. So far, the department has identified one individual who has been in close contact with this confirmed patient. The individual will remain in mandatory quarantine to help prevent and contain the spread of the virus. We're continuing to work closely with the New York State Department of Health to perform a comprehensive investigation to ensure that anyone who might have been exposed to the virus is isolated. In addition to our first positive case, we're currently monitoring 35 individuals under precautionary quarantine, formerly called voluntary home isolation. There are also 22 students, as you know, who recently returned from abroad in precautionary quarantine at the Stony Brook Southampton campus. They will remain in isolation for 12 more days now, a total of 14 days. I want to emphasize that these students were screened and none of them are symptomatic at this point. So this is an entirely precautionary measure. And that's a very important point with respect to all of this. All of this is prudence and precaution, making sure that we're doing everything we can to contain the virus as much as we can is the prudent thing to do. This is a new virus, so there's some things that we may not know about it. But there is no reason to panic here, to be overly concerned. All of the attention that people see in the news, on the radio, in the media about this is because this is a new virus and because there is a lot of effort going into containing it. That's why there's so much attention on this, and that's very important. It's not because there's a reason for everyone to panic. There is not a reason to panic. Most people who get the coronavirus, will be either asymptomatic or have symptoms that are similar to what you would expect in a cold and a flu. So there's not a reason to panic, but it is the prudent thing to do, it is the responsible thing to do, and it's what government is here to do everything we can to contain the virus, and that's what we're talking about here today, and it's what we've been preparing for. Since the beginning of February, we've been engaged in a multi-agency response coordinating that We remain in close contact with the CDC and the State Health Department on a daily basis. Receive the latest, most up-to-date information. We've done a full inventory here of personal protective equipment, particularly for our first responders. We're collaborating and sharing information with municipalities across the state who are also dealing with positive cases, and we're focused on public education to reassure residents again that there is no reason for alarm. And starting today, Suffolk Transportation Services will increase the frequency in which they sanitize their bus fleet, additional wipe down of high contact surfaces on buses with alcohol-based wipes. Top of all this, last week we brought together all departments within Suffolk County to conduct a tabletop exercise regarding coronavirus. This training event allowed us to assess and evaluate preparedness, run through possible scenarios, and ensure each department and agency within county government is familiar with procedures and protocols that are in place. And moving forward, we'll make sure that patients continue to be tested in accordance with CDC and State Department health guidelines. Now, this is very important to understand that testing is still limited at this point. There should not be an expectation that people can go in if they're feeling sick and just get tested. That is not going to happen. That is not what the guidelines call for, and quite frankly, it's not where we are in terms of testing capacity at that point. I know that is an issue that the governor has addressed. They are ramping up testing as we speak, but as of right now, if a medical professional determines they believe somebody should be tested, they will be in touch with the Department of Health, County Department of Health, who will consult with the State Department of Health, and if testing is necessary and meets the guidelines, that will be done, and then we will follow the protocols from there. So it's very important that people understand, there shouldn't be an expectation that if you are feeling ill, you're just gonna go to a doctor's office and get tested. It's not what the guidelines call for. It's not necessary at this point. When that changes, and when the capacity is there, that is something we will provide, information we'll provide, and we'll deliver different guidance at that point. We have tremendous partners on the state and federal levels who are working hand in glove with us to make sure that we do have the resources we need to remain prepared, and we're grateful for that as this continues to evolve and we need to react quickly. Those resources and that support is important, and knowing that it is there from the state and federal government, because the counties are on the front lines in dealing with a health crisis like this. And while we continue to do all that we can to avoid expansion, we certainly want people to understand what you should expect is the number of cases to rise. That is just common sense. It is not a cause for alarm. As the testing continues to expand, as testing comes online on a local level, rather than just having to do the testing or ship the testing to the State Department of Health, more people get tested, more cases will be confirmed. Again, that is not a cause for alarm. But it is important for people to just take common sense precautions. So if you're sick, stay home, contact your primary care physician, and you want to work to avoid spreading illness to others. Wash your hands using soap. I was at a press conference with Senator Schumer, who advised singing Happy Birthday. I know the message is getting through because my mother told me the same thing. You have to sing Happy Birthday twice, she told me. So that's a good thing if people are getting the message. And that's always good advice, by the way. This is just good common sense. Wash your hands throughout the day. That makes sense. Use hand sanitizer if you have it. Alternatively, additionally, avoid unnecessarily touching your face. This is a common thing people don't even think about, that we just routinely do as human beings. But it's advisable to limit that as much as you can. And actively wipe down commonly touched surfaces. These are common sense things you can do that can help avoid or limit the spread of the virus. We are, as I said, committed to working to contain the virus. We'll work with all of our partners to provide our doctors, hospitals, first responders with the tools that they need to ensure the health and safety of all of our residents as we prepare for any possible scenario. And when a public health emergency this level happens, we have to do whatever we can to address it, and that's exactly what we're doing. For any residents who have questions about symptoms, travel concerns, tips on preventative measures you or your loved ones can take, there is a tremendous amount of information on the Suffolk County webpage, suffolkcountyny.gov. And for more information, I would encourage you to visit that website. We will be updating that information on a regular basis, suffolkcountyny.gov. For those who don't have access to a reliable internet connection or after visiting the website have any other additional questions, residents may call Suffolk 311 and you'll be connected to a live operator who can direct your call, provide information, direct your call to the appropriate place. For those who are outside the county lines but would like to speak with a 311 operator, you can call 631-853-6311. We'll continue to encourage medical professionals, of course, will be contacting Suffolk County Health Department directly. As of this time, Suffolk County will be restricting all non-essential travel for Suffolk County government officials. We will continue to update you on that as far as any additional restrictions, but as of right now, we are restricting non-essential governmental travel. And as the situation continues to evolve, Suffolk residents should know that all levels of government here are coordinating together and doing everything possible to help contain the spread of the virus. And what we're asking for is continued cooperation with the public, working together. We will get through this. This is something that we will overcome. I'm going to do it in a calm, rational fashion. There is no reason to panic. Everything that needs to be done is happening right now, and as the situation does continue to evolve, we'll provide more information to alert the public as to what they need to know. With that,